Hello, my name is Shahada Balanain. I'm the correspondent for MedEdge MEA at the 7th Emirates Pediatric Hematology and Oncology Conference in Abu Dhabi. I'm honored to be joined by Dr. Jack Bartram from the United Kingdom. Dr. Jack is an internationally respected expert in pediatric hematology and oncology, with a particular focus on improving outcomes for infants with acute lymphoblastic leukemia. Welcome, Professor.
Thank you very much for the invitation.
Thank you very much. How are you finding the conference today?
Excellent being in Abu Dhabi. It's my fourth trip here and I love Abu Dhabi, and the conference is amazing.
That's good to hear. So can you kindly introduce yourself to our listeners?
Yeah, so my name's Dr. Jack Bartram. I'm a consultant pediatric hematologist at Great Ormond Street Hospital for Children, which is in central London. And it's a centre of excellence for pediatric care of especially complex and rare diseases.
So to start, can you briefly give an overview of what makes infant acute lymphoblastic leukemia in older children?
Yeah, so infant acute lymphoblastic leukemia is defined in patients who are under 1 year of age at diagnosis. But that alone, it doesn't explain the whole story, that they are completely different diseases. So in the last 20, 30 years, we've seen the outcomes for children with acute lymphoblastic leukemia become excellent, over 90-95%, and innovation and treatments have rapidly progressed. But that's really lagged behind in infants, where outcomes, traditionally have been sometimes less than 50%. And that is due to the biology of the disease. So infant acute lymphoblastic leukemia tends to be characterized by rearrangement of a gene called KMT2A, which characterizes a higher risk leukemia. And the infants tend to present with a higher burden of disease, a high white blood cell count, often disease in the spinal fluid. And generally, the practicalities of treating a younger child with intensive chemotherapy is more tricky, and the toxicities are greater. So those are the challenges that we've really been working with over the last few years to try and improve the outcomes.
And how does understanding these challenges of genetics and molecular characteristics shape the treatment strategies for those infants?
Yeah, so risk stratification is fundamental to any type of treatment for leukemia. And what has really advanced over the last 5 to 10 years is the advanced genomic diagnostics, so we can accurately characterize patients on day one of diagnosis. So the aim is to get treatment right first time, and risk stratification is all about delivering the right intensity of a patient, so you don't give them too much toxic therapy and cause lifelong problems, versus the risk of giving too little therapy and the risk of a relapse. So trying to get that balance right it is really difficult.
It's definitely crucial, the balance, that's true. However, there could be barriers, is that correct? What are the barriers that still exist in treating infants with ALL effectively?
Yeah, so the barriers are coming down, and what the problem was, there was a lack of treatment options. So in the past, we've focused on intensifying treatment more and more in these vulnerable babies. And what we only saw is this increased toxicity. And in fact, deaths from toxicity were increasing more and more. So what we had to do is have a revolutionary think about what we can do. And what we saw was the use of the drug immunotherapy blinatumomab, which we were seeing great success in older children and adults. We then have now translated that into the infant population. And what that's allowed us to do is heavily de-escalate the intensive chemotherapy, and you let the blinatumomab do the heavy lifting of that previous toxic therapy. So what we're finding is patients are tolerating it better, they're fitter, and they don't have these longer-term problems of what intensive chemotherapy delivers.
Yeah, that's definitely promising. And looking ahead into the future, what areas of research are you most hopeful about when it comes to improving the outcomes for infants with the acute lymphoblastic leukemia?
So infant leukemia is a rare disease, and so we need to work together. So it's conferences like this, it needs to be a global approach. We all need to work together collaboratively. And I think by sharing knowledge and information about how we're treating patients across this region and across the world, we can come together as a community to try and improve things. And I think we're already starting to see that now with the onboarding of immunotherapy in infant leukemia, which is improving outcomes already. So I'm really hopeful the next 5 to 10 years, we'll really see that toxicity come down and the overall cure come up. And the most important thing, this is with gentler, kinder therapies. So, I'm really hopeful for the future of this treatment of infant acute lymphoblastic leukemia going forward.
And if you can give a message to families that have recently received a diagnosis of infant acute lymphoblastic leukemia, giving them hope about treatment and prognosis.
Yeah, I mean, it's an incredibly scary journey for any parent or family, but there is hope now, I think, and certainly, things have accelerated in the last 2 or 3 years, especially in acute lymphoblastic leukemia, and I think that will just continue to increase. So yeah, it's a real message of hope and optimism. And the other thing is, to be aware that there's lots of people working on this disease all across the world, and we're working exactly, and we're working together collaboratively, and people are easily connected now, and it's a global community. So really, I am hopeful for the future.
Thank you very much, Chief Professor, for being here. I hope you enjoy the rest of the conference.
Thank you very much.